Well, welcome everybody. Thank you so much for joining us on this beautiful Friday afternoon. My name is Erin Stadler, and I am a first-year medical student at the University of Wisconsin School of Medicine and Public Health, and I'm originally from Fond du Lac, Wisconsin. So I am one of the new co-leaders of the SAFE chapter here at UW, and our chapter is really glad to be able to help co-host these sessions of this series on advocacy for firearm violence prevention. So SAFE, for those of you that don't know, is an acronym for Scrubs Addressing the Firearm Epidemic. We're a nonprofit organization made up of U.S. medical students, physicians, researchers, nurses, and other healthcare professionals who are dedicated to eliminating the firearm violence epidemic through research, education, and evidence-based policy. So the session today will focus on providing education on the evidence that secure storage laws work and then that will be followed by a discussion of how to use that in your own messaging. So once again, I'd just like to ask everybody to remain on mute, just to eliminate any background noise for our presenters. And now if everybody wants to just put comments in the chat to detail where you're from, maybe your institution or state that you're joining from, that would be great. And then before we get started, I also just wanted to briefly share what kind of drew me personally to this work. I first became really passionate about firearm violence prevention and advocacy after one of my siblings had a pretty major medical procedure done. And after speaking to his pediatric general surgeon, finding that he did a lot of work in advocacy and being kind of outspoken on a topic that can be kind of controversial in our state. And I just found that really inspiring to see a physician speaking about something that affects a lot of people in their community who too often become their patients. So that's kind of just a little bit about my story. And as we'll kind of touch on today, storytelling is a really important part of advocacy. So I just wanted to share that with everybody. So now I'm going to pass over the mic to Megan.
Thanks, Erin. Hi, everyone. My name is Nedden. I'm from Antigo, Wisconsin, up north, and I'm a fourth-year medical student at the University of Wisconsin as well. I just matched into pediatrics at the University of Wisconsin-Madison, and I hope to become a primary care pediatrician and be involved with my community and then advocacy at a legislative level as well. The overall goal of this six-part series over the next 12 months is to become better prepared medical students and healthcare professionals, to be knowledgeable and effective advocates for evidence-based firearm storage and child access prevention policies. All of us as healthcare professionals are already natural advocates for our patients. We are concerned about our patient safety, and this concern translates into powerful advocacy. For me, the reason I became involved in firearm injury prevention advocacy is because when I was in high school, one of my friends died by suicide, and I also had a school shooting. I'm involved with the American Foundation for Suicide Prevention, and I'm passionate about preventative medicine in pediatric patients. So firearm injury prevention is just a space where really all my interests and passions overlap and where I feel like there's a lot of opportunity to make significant and impactful change. I'm hopeful that SAFE helps to educate current and future healthcare clinicians on the importance of sharing their trusted voices on firearm injury prevention policies, such as secure storage. My state has a chance of improving policies that will ultimately reduce injury and death by firearm for our community members and our current and future patients. By participating in the Secure Firearm Storage Education and Policy Series by SAFE, you will be able to think critically and independently about the secure storage laws in your state, form your own opinions on the subject, and be able to articulate, should the state secure storage law be changed? If so, why? And if so, how? The series will help you to become more knowledgeable and effective advocates for evidence-based secure firearm storage and child access prevention policies. If you have time after the presentation and Q&A today, which will last until 12:50 Central Time, feel free to stay on the Zoom because SAFE's Executive Director, Allison Volkman, and Dr. Susie MacLean, our featured presenter and one of SAFE's founding board members, will be staying on the Zoom until 1 p.m. Central Time to answer additional questions or help connect people.
Thanks so much, Megan. So after Dr. MacLean finishes her portion of today's event, we're going to hear from two leading firearm injury prevention professionals from Giffords, which is a national organization focused on research and advocacy regarding gun violence prevention. So Alex Nguyen is a senior research manager, and Erin Earp is Giffords' state and federal policy attorney. They will both share their perspectives and advice for our audience, made up mostly of current and future healthcare providers. In February, at our first session in the series, we shared an advocacy opportunity for Wisconsin-based folks called Doctors Day at the Wisconsin State Capitol. And while that event is still going on in early June, we're also encouraging anybody able to in Wisconsin to attend a Day of Action, which is being hosted by WAVE. That stands for Wisconsin Anti-Violence Effort, and that will be at the Wisconsin State Capitol on May 20th, focused directly on gun violence prevention. So we're going to put a link in the chat for that now, for everyone to register who's able.
And then speaking of WAVE, we also have with us today Nick Matuszewski, the Associate Executive Director at WAVE, a state-based nonprofit organization that recently formed a healthcare coalition for Wisconsin healthcare providers. We're giving him a shout out today, so thanks, Nick, as he and WAVE have been great partners with SAFE, and he will be presenting at SAFE's third session in this six-part series. We'll be sure to send a registration link for that event, which will take place sometime in the middle of May or early May. I missed that. Earlier mid-May. We are thrilled that WAVE is putting on this event, and it's a great opportunity to practice your advocacy skills with state legislators and their aides. And now for the next 20 minutes or so, we'll hear from Dr. Susie MacLean. Her reasons for doing this work today are compelling, so I'll ask that she introduces herself and how she came to be with us today. The
Thank
floor
you,
is yours,
Megan.
Dr. MacLean. Yeah, thank you for being here.
Yeah, thank you. And hello, everyone. My name is Susie MacLean. I'm on the board of directors at SAFE, and I started volunteering with SAFE in 2018 when I retired from a 30-year career in primary care internal medicine. And I decided that I wanted to devote my volunteer energies to gun violence prevention, and specifically using my physician voice to try to reduce firearm harm. So one of the projects I worked on was trying to improve California's secure firearm storage laws. And I'm happy to say we were successful in getting an improved law passed in 2024. And in the process, I learned a lot along the way about secure storage laws. And I'm hoping to share some of those learnings with you in these sessions. So the last session, we covered the landscape of firearm storage laws across the US, looking at the different laws and hopefully giving you a context and a framework to look at Wisconsin's law. And today I'm going to cover sort of background information and evidence that secure firearm storage laws save lives. My slides are intended to be a resource for you, so there's a lot of links in there to studies that you can use and look at later when you're developing your talking points, if you will, to reach out to your elected representatives. So I'm going to get my slides on the screen. So does that look good? Can I see a thumbs up? All right, good. Great. Let's get started. So I'm going to focus on secure firearm storage saving lives, specifically looking at children and teens. And I'm going to be using a public health approach. And by that, I mean using data and science to look at what are effective policies and practices. So Johns Hopkins School of Public Health is a trusted resource for information about gun violence. They have a wonderful gun violence solutions department. And this is something they published in 2024. And I'm going to be using some of the resources from this in my discussion today. So we have used public health approaches in the past to improve the health of our society, reducing death and injury. And specifically, we've used safety devices like car seats, which are required in all 50 states. And obviously, it's something we also discuss with patients in pediatric appointments. We can use the same approach to reduce firearm injury and death. So public health approach, I've listed here that's sort of the classic 4 steps in a public health approach. And we're going to start with defining the problem. So as many of you know, death by firearm is the #1 cause of death for children now since for the last 4 years. And it's increasing. Between 2013 and 2022, the firearm death rate among children and teens increased by more than 100%. And these are preventable deaths. They're tragedies. 6 children die every day, and in addition, 25 to 60 children are injured every day. And I've put photos of children and teens here to remind us that we have to do a better job in protecting them. And I'm going to be focusing on data today, but I don't want us to forget their humanity and the lives at stake. So digging into the data, this is data from the CDC's website that I extracted about a month ago. It's the distribution of firearm deaths among youth in the US from the year 2022. The total deaths are around 2,200. And I created this pie chart because I think it's helpful to look at it visually. And sadly and tragically, 63% of deaths are homicides, 27% suicides, and 8% unintentional. Unintentional is where a child shoots themselves or someone else. This graph is data that I took from the Johns Hopkins School of Public Health publication that I referenced earlier. It details deaths by age group, as well as the causes of death, homicide, suicide, or unintentional. So if you look at the age group 1 to 4, you'll see that 35% of firearm deaths are in the unintentional category. And actually the raw number, 49, is the highest of all of the age groups. After age 10, you'll see rising numbers of suicide and homicide deaths. And then if you look at the age groups 1 to 17 in total, 70% of the deaths are in the 15 to 17 age group. So I'm going to say a few words about each of these causes of death. As I mentioned, homicide is 63% of the deaths. If you look at under age 13, most of those deaths are at home, 85%. And many are related to intimate partner violence or some family conflict. If you looked at older teens, the homicides are mostly victims in the context of crime and violence. And I've put on the right side a graph to highlight the significant racial disparity in gun homicide rates for youth, for Black youth specifically. So if you, the light blue line is for Caucasian, the dark blue Hispanic, and the golden is for Black. And you can see a large racial disparity for homicide gun deaths in our Black youth. Okay, a few words about suicide, which are 27% of childhood firearm deaths. It turns out that firearms are used in about 50% of youth suicides. And most of those firearms, 75%, are firearms that are accessed from their home or a relative's home. Now, I'm going to mention two what I call misperceptions, public misperceptions, and this is the first one. There is a perceived lack of utility for secure storage in preventing suicide. And I think it's important to see where blind spots are in the public when we're having conversations with our patients and with our elected representatives. So I've quoted this study here, which details the information that there's a perception of lack of utility for using secure storage method as a suicide prevention tool among firearm owners who currently store their firearms loaded and unlocked. So a few additional words about unintentional injuries. Everytown for Gun Safety has published this interesting tracking tool for like the last decade. And hopefully Allison will put that link in the chat so you can take a look at it yourself. I'm going to walk you through it with some screenshots on this slide. So if you open it up, you'll see the large US map that you see here on the left on my slide. And it's for 2025 data to date for this year for the US. And you'll see red dots where there's reported death and blue dots where there's reported injury. These are firearm deaths or injuries that are unintentional shootings by children. And I was interested. I opened this up and I took this screenshot about a month ago, and I saw the red dot in Wisconsin. I was like, okay, what happened? And so if you click on the red dot, you'll see the upper right screenshot I've taken here. It shows the information, which is from February of this year in Milwaukee. A 4-year-old girl unintentionally shot and killed herself after she found a handgun under a pillow in the bedroom. And the handgun belonged to the boyfriend of her aunt. So I find it interesting to look at the stories about what's happening where. You can also change the filter parameters that I show here in the lower right. You can look at just your state, Wisconsin, and I have all years, so the last 10 years, and you can see where there have been injuries and deaths, and you can see there's six deaths in Madison and 49 in Milwaukee. And again, these are the unintentional shootings by children. So now I'm going to move on to identifying risk and protective factors. So, we've been talking about homicide, suicide, and unintentional injuries. Obviously, there's a host of factors that go into these tragedies. And I'm going to focus on what I'm calling the common denominator, which is access to unsecured firearms. So looking at risk factors, nationwide, over 4.5 million children live in households with access to unsecured firearms. And nationwide, about 50% of firearm owners do not store all of their firearms securely, which is unloaded, locked, and ammunition stored separately. And you might be wondering how many households or what percentage of Wisconsin households have firearms, and that's 43%. So most firearm owners are deeply committed to firearm safety, but I'm going to mention here the second misconception that exists. Parents often underestimate the risk of their child gaining access to the household firearm. And I've quoted here a study: in cases where the parent believed the child could not access the firearm, over 20% of children said they could access it in less than 5 minutes. So looking at protective factors, would secure firearm storage save lives? And the answer is yes. And I've quoted down at the bottom, I've cited the most commonly cited article supporting this. And the article concludes that keeping guns locked and unloaded and storing ammunition locked and in a separate location are associated with a protective effect on youth suicide and unintentional firearm injuries. So now moving on to testing prevention strategies. I'm giving a shout out to RAND Gun Policy in America, another very trusted source. They do a comprehensive review of the literature of studies looking at outcomes on policy. And they have looked at this question, do secure firearms storage laws save lives? And their answer is yes. And I'll just want to say a few more things about their process. It's what I would call rigorous. They rate the quality of evidence for any given policy as either inconclusive, not enough information, limited, moderate, or supportive. So supportive is their highest level of evidence, and it requires that there are 3 or more studies of high quality with no contraindicating evidence. So their analysis regarding CAP laws was, that's child access prevention laws. There was supportive evidence, their highest level, that CAP laws reduce youth homicides and assaults, reduce unintentional firearm injuries and death, and reduce youth suicide. So all 3 major areas that we've been discussing. The percentage in parentheses I have there was taken from one of the studies that they looked in their analysis, just to give you some idea of the magnitude that they saw. Now, an important question from my point of view are the more stringent CAP laws associated with greater reductions in fatalities? And the answer is probably yes, but I will say more studies are needed. I have quoted here one study that looked at this, and they separated out the different child access prevention laws based on whether a child could access or does access or actually uses the firearm, these different levels of CAP laws that we discussed last time. And they were able to see that there was a 59% reduction in unintentional firearm deaths with the strongest CAP law. So I do want to bring up one fact about school shootings. And this data is from the Department of Homeland Security. They published a report looking at data from 2008 to 2017. And that report states that 75% of school shooters obtained the firearm from their parents' home or the home of a close relative. So we have to hope that secure storage could prevent children from bringing these firearms to school. And I want to say a couple words about firearm theft. This is a problem that's increasing. And firearm theft occurs from homes and cars. And I think now cars are now a more common source of theft for firearms compared to homes. And obviously these firearms end up in the wrong hands much of the time. I've cited a case here because I think it's interesting when an event triggers a movement to improve laws. So in 2012, a man used a stolen assault-style rifle to carry out a mass shooting in a crowded mall a couple weeks before Christmas in a town called Hope Valley, Oregon. And at the time, Oregon had a CAP law in place, a good CAP law, but they did not have a required secure storage law. And as we discussed in our last session, that's a law that states that a firearm owner must keep the firearm securely locked anytime it's not under their immediate control. So it turned out the victims' families in this, after this mall shooting, became advocates to add a required secure storage law to Oregon's law, and they were able to get that passed in 2021. So now, finally, ensuring widespread adoption of effective strategies. That's where you all come in. Start with your state. As we discussed in our last session, Wisconsin has a relatively weak cap law. It can be changed. You can use your voice to make change happen. I've added a resource here. Now, just 3 days ago, Johns Hopkins School of Public Health put out another very useful resource, and it's on safe storage model policy guide. And so there's a resource in the slide for you that you can look that up. It covers a lot of material that I've tried to cover in my talk, and it also talks specifically about what kinds of things to advocate for. And here's your opportunity to advocate. WAVE is sponsoring a day of action coming up in Madison in May, and it looks like it's going to be a great event. We really are excited for some of our folks to participate in this, and you can register for that and participate. So that concludes my part of the talk. I would like to invite our friends from Giffords, Erin and Alex, to make comments and share their thoughts. So thank you.
Thank you. I wanted to start by reintroducing myself. My name is Alex Nguyen. I'm the Senior Research Manager at Giffords Law Center. And here today with me is my colleague, Erin Earp, our Senior Policy Attorney. It was mentioned earlier, but Giffords Law Center is a national gun violence prevention advocacy organization. And we're going to talk a little bit today, expand on what we've discussed about safe storage and child access prevention laws. As we just saw in the fantastic presentation, we have great evidence to show that safe storage and cap laws help save lives from gun violence. But the one thing that Erin and I wanted to highlight for you all today is that while these laws are effective, we still have a lot more work to be done. We've seen plenty of examples that show that the public isn't fully aware of these laws and what they entail, and that everyone, including physicians and everybody on this call, can do more to increase awareness about these laws. As a quick example, a 2019 survey asked gun owners if they knew whether or not their state had a safe storage or cap law, and less than half, at somewhere around 45%, were actually aware if there was a law on the books in their state. And in the same survey, when they asked gun owners who actually lived in a state with a safe storage or a cap law, that percentage was even lower. Only 38% could identify that their state had passed such a law. Erin?
Yeah, and so while these laws do include penalties for violating the law, ideally those penalties would never need to be used. You know, their purpose is prevention. Like we all talk about preventing accidental shootings, preventing theft of these firearms, preventing school shootings, suicides, making sure that children or dangerous individuals can't get a hold of these guns. But that can't be accomplished without awareness of both what these laws say, what it means to securely store a firearm, and also awareness of really the importance of securely storing a firearm. And so, you know, it's important that cap laws not only say, you know, how a gun should be stored, but they also include provisions that increase awareness around safe storage laws, that help gun owners access safe storage devices, and things like that. But you know, raising awareness about safe storage doesn't have to rely solely on legislative action. You know, I do legislative work here in Wisconsin and also in a number of other states across kind of the political spectrum, and we know that there are some places that are not always going to necessarily be amenable to changing their laws, and so there are other ways to, you know, change the conversation around what it means to be a responsible gun owner and, you know, how people should be storing their laws and Obviously physicians can have a big role in having those conversations and talking about what it means to, safely and responsibly store a firearm. And part of the problem here, and why raising awareness is so important is, that parents often just are mistaken, or there's a disconnect around their beliefs about whether their children can get access to their firearms. And I think this is the same study that Dr. MacLean touched on. But there's this 2021 survey of parents who had firearms in their home, and 70% of them reported that adolescents in their household couldn't independently access the firearms in the house. But of that 70%, 1/3 of the children living in those households reported that they could access those firearms in less than 5 minutes. And so, I think there is an idea among parents of saying, oh, my child couldn't get a hold of this gun, or my child isn't going to be the one that gets a hold of my gun. And I'm sure that is something that every parent believes until, unfortunately it is their child that gets a hold of the gun and hurts themselves or someone else. And so, these are shootings that I think everyone collectively after the fact thinks that this is a terrible thing that didn't have to happen. And so how do we kind of bring that conversation? How do we back that up a step and have these conversations in a way that makes people understand the risk, but in a conversation that is something that is so preventable when people just take some really common sense steps. And how do we have those conversations and increase that awareness in a way that people can be receptive? And I think there's a big role there for folks in the medical profession. And I'll hand it back to Alex to talk about that.
I'm going to pick up right where Erin left off. A lot of times folks don't know who to turn to when they want to have conversations about safe firearm storage. And we've seen that physicians and medical professionals alike have been identified as one of the most trusted, credible messengers for delivering information about safe storage practices and safe storage laws. There was another 2019 survey, a separate one from the one I was talking about earlier, that showed that only 1 in 13 American adults, or about 8%, had ever discussed firearm safety with their physician. But in that same survey, 80% of those who took it said that they wanted their physician to discuss firearm safety with their patients. But from conversations we've had with physicians, plus reading the literature, we understand that these can be really difficult conversations for medical professionals to have with their patients. In 2018, when asked, some medical residents reported concerns over legality, how to initiate this conversation with their patient, knowing the right vocabulary to use, or being perhaps more culturally competent with gun culture in general, and then also knowing what to do in response or after these conversations. These are all valid concerns that I'm sure still hold in some way, shape, or form today. And I know these can be difficult conversations, but we've seen programs that guide physicians on best practices to discuss secure storage with their patients. They've seen a lot of success. For example, there's a VA program that found discussing safe storage with their patients elevated both the importance of talking about and comfort with secure storage practices. And so we hope that our short remarks today will highlight for you all the role that physicians can play in the broader gun violence prevention ecosystem. We need your help in making sure that your patients know about these laws, about safe storage practices, and that they continue to engage in these practices. Erin and I will send the organizers all the studies we just talked about in case anybody wants to follow up on any of them. And thank you. Thank you very much.
Yep. And I had planned on sending around a link to the same Johns Hopkins report that Dr. MacLean shared. I will just reemphasize, definitely take a look at that. They have a lot of great recommendations. There's a policy checklist in there. And I work with folks at Johns Hopkins a lot doing state policy work. I actually work with them along with Nick here on a coalition here in Wisconsin on safe storage and other policy issues. They also have a lot of great research folks there. So it's a great resource for advocacy on safe storage. Yeah, definitely would recommend taking a look at that.
Thank you so much to all of you. That was really, really helpful, and definitely has me thinking about next steps that I can be taking. So I really appreciate you sharing. Safe values the partnership with Giffords, and we're just really grateful that you both were here and able to join us today. And then to everyone else on the Zoom call, I just want to acknowledge that this is difficult work. Convincing lawmakers that effective firearm injury prevention laws saves lives doesn't feel like something we should have to do. But it's something that, as our profession warrants, it's just something that we have the privilege of being able to do. And we do get to share patient stories where they might not be able to. I know that we all advocate for our patients every day. As physicians, nurses, other healthcare providers, and then some of us are just learning as medical students. So it's important to learn how to do that at an individual level and then also on a systems-based level. So we just really appreciate everyone for showing up today. And then we'll reshare all the resources. I know Allison's been in the chat saying that with you after the event, including the slides. And I'll hand it over to Erin.
Yeah, so now we're just going to shift into the Q&A portion of the event. So if you have any questions that you ask, please feel free to drop it in the chat and we'll direct it to either Dr. MacLean, Erin, or Alex, and they'll get to as many as they can in the next 10 minutes or so. And then once the Q&A portion is done, or if you have to hop off before, feel free, but they will be staying on the call to just kind of network and chat with anybody who's interested. So feel free to either take yourself off mute and ask or send something in the chat.
So I have a question actually for Erin and Alex. What do you think the appetite is in the Wisconsin legislature body for change around secure storage? Do you have any feeling for that?
I might want to put Nick on the spot here if he doesn't mind.
Yeah, happy to. We've had, hi everyone, Nick with Wave. We've had some really good conversations with a lot of folks in the legislature around some of these secure storage policies. I think that there's a better chance that these policies move forward than we've seen in several sessions. It's so hard to say early on. I think there's going to be a lot of more discussions happening after the budget process. But we've had conversations with a lot of offices that in the past wouldn't even consider these options, and now they're discussing whether or not they can author the bills. So definitely more hopeful, but we'll have to wait and see. And hopefully, by the time we have our advocacy day in May, we'll have more, answers to how it's looking and what we can expect.
Dr. MacLean, oh, sorry. We actually got a message in the chat. Someone is asking what the difference is between safe and secure storage.
Those, from my perspective, those words are used interchangeably. There has been some, I have heard from some gun owners that they prefer the term secure storage as opposed to safe storage. I don't know if anybody has any other comments from the audience about that terminology.
I will just sort of plus one what Dr. MacLean has said. We have a gun owners coalition here at Giffords where we partner with gun owners to help us advocate for laws because we find them to be some of the most credible messengers in terms of talking to lawmakers. Sorry, my brain shorted out for a second, but they also echo the sentiment that secure storage is the more preferred term, especially among the gun owners community.
Yeah, and I think as a result, I'm trying to use the term secure storage more, so I'm not inadvertently offending any gun owners. Yeah.
I would just chime in to say, I think that when you consider the broader movement about gun control, gun safety is the preferred term now. And my sense is that the idea of gun safety then has been applied to safe storage. That's kind of how I've seen the language develop. But can I just say thank you to the presenters, first of all. Susie, that was just outstanding. And you said you would share the slide deck with us?
Yes, it's meant to be a resource, so that it was designed partly for this presentation, but partly as a document that you can go back to.
Well, the public health approach and the 4 steps that you outline are absolutely crystal clear. So I really thank you for that. And then to my colleagues, Erin and Alex, I'm not sure we've met before, but I'm on the Giffords board, and I just want to thank you for the work that you're doing. And have a question. If we wanted to analyze the current state of safe storage, secure storage in Wisconsin, and help craft legislation, how could that process unfold? And I'm thinking of what Nick just said, because Nick, I understand you're on this topic. How could that specific action step be implemented?
So right now there is language. It exists in the governor's budget right now, along with a number of other gun violence prevention policy initiatives that are kind of, instead of being in their own bill, they're living right now in the governor's budget. And I guess I'll sort of defer to Nick if he's still here. If we think, I'm not sure politically if we think that's going to move as part of the budget, or if they're going to end up, it's going to end up separately. But we have been working with the coalition on safe storage language for bills to move this session. Just right now, like it exists right now just in the governor's budget, but whether it's going to move in that vehicle or in a separate bill, like as its standalone bill, I think it's kind of just depends on how things move in the legislature.
And Erin, do you and Nick have a map of the legislators to work with to try and ultimately move that along?
As far as like a physical map?
No, just a roster of who are the leaders in the legislature and who can be influenced, such that once legislation is crafted, the advocacy groups then would know who to call, who to message. Where are we in that process?
Yeah, I mean, I think Nick and like the folks on our government affairs side would have more like in the weeds details on that, because they're the folks that are doing like the day-to-day, like in the weeds on the like moving the bill through every step kind of process, along with our other coalition folks. Because I'm more on like the bill writing end of things. But as Nick said, I know they've been having conversations with trying to figure out who might be the best folks to kind of, there's Nick, to kind of spearhead this going through. But yeah, as far as like at Giffords, the government affairs folks are going to be kind of the folks who are going to lead things on the movement through those kinds of phases.
I can pick up there and just add a couple quick things. Yeah, we are expecting that the language that's in the budget, the governor's budget proposal, will probably get taken out. Whereas we do feel optimistic about this being presented as a standalone bill and getting some supporters. Republicans have made it really clear that a lot of these more policy proposals and that aren't traditional budget items will be removed from the budget. So we have had conversations with people, though, and it does sound like there are, like I was saying earlier, Republicans that are interested in supporting this. So Paul, to your point, we have kind of an idea and a list of key targets and names that we're working with. So happy to connect offline too if that's helpful or for anybody, and kind of walk through more of the in-detail strategy or in-depth strategy around this push.
And I think the session 3 in this series, I believe, is going to be kind of the legislative piece with Nick, with you, and then Sean from our government affairs team here at Giffords is going to be a part of that, I believe.
Yeah.
I have a quick question, Nick. If you could just give kind of a quick overview of what the day of action will look like as far as just like an agenda or what participants could expect that day.
Sure. Yeah, and thank you for highlighting it. So we have done these days of action every other year when the legislature is really kind of picking up, and where we aren't at the point right now where we have the full agenda. I can kind of walk through what we expect it to look like based on past days of action. It'll probably start around 8 in the morning, or at least breakfast will be then. I think we'll officially start programming around 9. We'll have a few hours of sessions explaining the policies that we're pushing for, and maybe doing some role playing around how to talk to your legislators if you've never done that before, giving you some intel on where the bills are and what to expect when you meet with your legislators. Then we'll have lunch, and then we will all walk over to the Capitol. It's just going to be a couple blocks, and transportation will be provided for anyone that needs it. And everyone will have a chance to meet with their legislators, and potentially take a few extra meetings if your time allows for it. So kind of a typical day of action if you've been part of any other organizations, but we find it really helpful to have hundreds of people at the Capitol on this issue, all speaking with one voice. Thanks.
Well, if there aren't any further questions, I'm going to just say thank you to Erin and Alex for joining us today, and Nick as well, and also to Megan and Erin for hosting, and for all of you who've just shown up and listened and had great questions. I'm going to stay on Zoom for a while along with Allison if anybody wants to connect or have more conversation. Otherwise, we just want to thank you for being here and hope you have a great rest of your weekend. And we look forward to keeping in touch with you, and stay safe, everyone.